Hi, I'm Dr. Altaf, and I want to ask you something honest. How do you feel when your alarm goes off in the morning? Not groggy in that normal, I need my coffee way, but genuinely exhausted, like you never actually slept, like your body is running on empty before the day has even started. If that sounds familiar, I want you to know you are not alone, and more importantly, you are not imagining it. A lot of people in this situation assume they just need better sleep habits, or less stress, or maybe a different mattress. And sometimes that's true. But sometimes, and this is what I really want to talk about today, the fatigue you're feeling in the morning isn't about your sleep at all. Sometimes it's your thyroid trying to tell you something. Now, before I go further, I want to be very clear about something. Most morning fatigue does not come from thyroid problems. The majority of people who feel tired in the mornings have lifestyle-related causes: irregular sleep, diet, stress, alcohol, or simply not getting enough hours. I'm not here to alarm you. I'm here to give you accurate information so you can recognize what's normal, what warrants attention, and what genuinely needs a doctor's eyes on it. That's what this channel is for. So let's talk about the thyroid, what it actually does, what happens when it starts to underperform, and what the research tells us about recognizing the difference between everyday tiredness and something that deserves a closer look. Let me start with the basics, because understanding what the thyroid does is really the foundation of everything else. Your thyroid is a small, butterfly-shaped gland sitting at the front of your neck, just below your voice box. It might be small, but its influence is enormous. The thyroid produces hormones, primarily thyroxine, which most people know as T4, and triiodothyronine, known as T3. These hormones travel through your bloodstream and affect almost every single cell in your body. They regulate your metabolism, which is essentially the rate at which your cells convert nutrients into energy. Think of your thyroid like the thermostat for your entire body's engine. When it's calibrated correctly, your energy levels, your heart rate, your body temperature, your digestion, and even your mood all tend to function within a healthy range. When the thermostat drifts, particularly when it drifts downward, the engine starts to run too slowly. That condition, where the thyroid becomes underactive, is called hypothyroidism. And here's the thing about hypothyroidism that makes it so easy to miss. It doesn't announce itself dramatically. It creeps in gradually through symptoms that are easy to dismiss, easy to attribute to other things, and easy to live with for months or even years before anyone connects the dots. Fatigue is almost always the first and most prominent symptom. Now, here's where I need to be careful with you, because this is where a lot of health content gets things wrong. Not every person who feels tired in the morning has a thyroid problem. That would be a significant exaggeration of what the science actually shows. Most fatigue, even persistent fatigue, is multifactorial, meaning it comes from several overlapping causes, not one single source. However, and this is important, thyroid-related fatigue does have some recognizable patterns that set it apart from regular tiredness. Research published in peer-reviewed endocrinology literature consistently identifies fatigue as the most commonly reported symptom in hypothyroidism, occurring in somewhere between 70 and 80% of patients with confirmed diagnoses. What distinguishes thyroid fatigue from ordinary tiredness is typically its quality, its persistence, and the way it clusters with other symptoms. Let me walk you through what I mean. With lifestyle-related fatigue, the kind that comes from poor sleep, high stress, or irregular schedules, you usually feel better after a good night's rest. A long weekend, a vacation, a few early nights, and the tiredness starts to ease. Your body responds to rest. With thyroid-related fatigue, rest doesn't fix it the way you'd expect. People describe waking up after 8 or 9 hours of sleep and still feeling as though they barely closed their eyes. The fatigue doesn't lift as the day progresses the way it typically does with normal morning grogginess, and it tends to come alongside other subtle changes in the body that, when looked at together, start to form a clearer picture. So what are those other signs that, when combined with persistent morning fatigue, might suggest it's worth getting your thyroid checked? I want to be transparent here. No single symptom is diagnostic. A blood test is what actually tells you whether your thyroid function is abnormal, but symptom patterns can give you and your doctor useful information. One of the most commonly reported companions to thyroid fatigue is unexplained weight changes. In hypothyroidism, the metabolism slows, meaning the body burns fewer calories at rest. This can lead to gradual, unexplained weight gain even when eating habits haven't changed. It's typically modest in the early stages, but it can be frustrating and confusing for people who feel they are doing everything right. Temperature sensitivity is another one. People with underactive thyroids often feel cold when others around them are comfortable. This isn't about being someone who runs cold. It's a noticeable change from how you used to feel, a shift toward persistent chilliness, cold hands and feet, and difficulty warming up. Brain fog deserves its own mention because it's one of the most distressing aspects of thyroid dysfunction that people talk about. The research supports its presence in hypothyroid patients. Difficulty concentrating, slower thinking, forgetfulness, and a kind of mental heaviness that makes even simple tasks feel laborious. Again, brain fog has many causes, and thyroid dysfunction is just one of them. But when it shows up alongside fatigue and other symptoms, it adds to the picture worth investigating. Hair changes are frequently reported too. Increased hair shedding, or hair that becomes noticeably drier or more brittle. The skin can become drier as well. The nails may become more fragile. Mood changes, particularly a low mood or increased emotional sensitivity, are also documented in the research. The connection between thyroid hormones and mood regulation is well established. Thyroid hormones interact with neurotransmitter systems, and when levels drop, mood can drop with them. And some people experience a slower heart rate, constipation, or a general slowing of bodily processes that they might not immediately connect to a single cause. The key point, and I want to say this clearly, is that these symptoms are individually nonspecific. Any one of them could have a dozen other explanations, but when several of them appear together, particularly in the context of persistent fatigue that isn't responding to rest and lifestyle changes, that's when it's genuinely worth having a conversation with your doctor about testing. So what does testing actually involve? The primary blood test used to evaluate thyroid function is called the TSH test. Thyroid stimulating hormone. TSH is produced by your pituitary gland and acts as the body's signal to the thyroid to produce more hormones. When thyroid hormone levels are low, the pituitary ramps up TSH production to try to compensate. So an elevated TSH is typically the first laboratory sign of hypothyroidism. Most guidelines consider a TSH between roughly 0.4 and 4.0 millionits per liter to be within the normal range, though there is ongoing nuanced discussion in the endocrinology community about whether the upper end of that range should be refined, particularly for older adults and pregnant women. This is an area where the science is still evolving, and reasonable clinicians have thoughtful disagreements. If your TSH comes back elevated, your doctor will likely follow up with tests of T4 levels, and sometimes T3, to get a fuller picture of how your thyroid is functioning. There's also a condition called subclinical hypothyroidism, where TSH is mildly elevated but T4 remains within normal range. Research on whether to treat subclinical hypothyroidism is mixed, and the decision is individualized. It depends on factors like the degree of TSH elevation, symptoms, age, and other health conditions. This is genuinely a nuanced area where your doctor's judgment, applied to your specific situation, matters enormously. If you've been feeling persistently fatigued and you're concerned, a simple conversation with your doctor is the appropriate next step. Thyroid function testing is straightforward, accessible, and covered by most healthcare systems in the US, UK, Canada, and Australia. It's not an overreaction to ask for it when you have consistent, unexplained fatigue alongside other symptoms. It's actually very reasonable. Now let's talk about what happens if a thyroid problem is confirmed. Hypothyroidism is one of the most treatable endocrine conditions in medicine. The standard treatment, levothyroxine, a synthetic form of T4, has decades of clinical evidence behind it. For the vast majority of people with hypothyroidism, once the correct dose is established, symptoms resolve significantly and quality of life returns to normal. Dosing is individualized and often requires some adjustment over time. Regular monitoring with blood tests is part of ongoing management. Most people tolerate the medication very well, and when managed properly, hypothyroidism is genuinely a condition that most people live with comfortably. I mention this because health content around thyroid disease can sometimes leave people feeling frightened or overwhelmed. The reality is much more encouraging. Yes, hypothyroidism requires ongoing management, but with appropriate treatment and regular monitoring, the vast majority of people do very well. Now, I want to step back for a moment and talk about something broader, because I think it matters for your overall health literacy, not just thyroid health. One of the most important things you can do for your health is learn to recognize when fatigue is worth investigating further. The vast majority of fatigue is lifestyle related and responds to lifestyle changes. Better sleep habits, addressing stress, reducing alcohol, improving nutrition, increasing physical activity. These fundamentals matter enormously and are worth addressing first, but persistent, unexplained unexplained fatigue that doesn't respond to these changes, especially when it comes alongside other symptoms you can't explain, is a signal worth taking seriously. Not with panic, not with alarm, but with the practical, calm approach of someone who values their health and knows when it's time to get some answers. Thyroid dysfunction is just one of several medical causes that can present with fatigue. Anemia, diabetes, sleep apnea, depression, vitamin deficiencies, and cardiovascular conditions can all cause fatigue as well. This is exactly why seeing a doctor and getting appropriate tests is so much more valuable than trying to self-diagnose based on a symptom list. A good doctor will look at the full picture, your symptom history, your lifestyle, your blood work, and help you understand what's actually going on. So here's your practical takeaway from today. If you experience morning fatigue that feels different from ordinary tiredness, if it's persistent, if rest doesn't relieve it, and if it's accompanied by any combination of unexplained weight changes, temperature sensitivity, brain fog, mood shifts, or the other symptoms we discussed, bring it up with your doctor. Ask specifically about thyroid function testing. Don't catastrophize and don't dismiss it either. Just ask. If your thyroid tests come back normal, that's genuinely good news, and it gives you and your doctor the opportunity to look at other potential causes. If they show something worth addressing, you'll be glad you caught it early. Either way, you'll have real information rather than uncertainty, and real information is always better than guessing. If you're already managing a thyroid condition and you've been feeling off despite treatment, it's worth revisiting your dosing and monitoring with your doctor. Thyroid needs can change over time, particularly with age, weight changes, pregnancy, or other health shifts. I hope today's video gave you something genuinely useful. A clearer picture of what the thyroid does, how to recognize when fatigue might be worth investigating, and what to expect from testing and treatment if it turns out your thyroid is involved. That's what I want this channel to be for you. Honest, evidence-based health information that helps you make better decisions, ask better questions, and feel more confident navigating your own health. If you found this helpful, I'd love for you to subscribe to Dr. Altaf's channel. Every week I cover health topics like this one, grounded in real science, explained in plain language, and always focused on what's actually useful to you. There's a lot of health content out there that's designed to alarm you or overwhelm you. I want this channel to be the opposite of that, a place you come to feel informed and empowered, not scared. Thank you for watching. Take care of yourselves, and I'll see you in the next one.